Public health effects on the geriatric patient. The three public health issues that I chose were poverty, changes to the mind, and the holistic model. Poverty among those aged 65 and older has decreased overall since 1967, though there has been a significant increase in poverty between 2015 and 2016. There is evidence that near poor seniors are being pushed into poverty because of medical expenses, and the rate of poverty among seniors increases with age and is higher among women, African Americans, and Hispanics. A serious illness or injury can force a senior to choose between paying for medication and eating, and may drop him or her below the poverty line. So here I have a picture, and it shows that more than 7 million people ages 65 and older had incomes below poverty in 2017, and then 2.5 million more than under the official poverty measure. Under the official poverty measure, 4.7 million adults ages 65 and older lived in poverty in 2017, but then that number increases to 7.2 million based on the supplemental poverty measure. Poor health is both a cause and an outcome of homelessness. Poor health can lead to work absence, job loss, financial crisis, and subsequent homelessness. Homeless older adults aged 50 to 62 have a similar level of healthcare needs as those 10 to 20 years older who are housed. Common among older homeless adults are cognitive impairments, vision and hearing difficulties, and problems with walking. Until homeless adults reach the age of 62, when they become eligible for social safety net programs, such as subsidized housing, and at age 65 when they become eligible for Medicare and Social Security. But some people they don't meet the criteria for some government assistance programs. So that would be poverty. And then changes to the mind or cognitive health would be my second public health issue. Psychological changes can be influenced by general health status, genetic factors, educational achievement, activity, and physical and social changes. With a growing older adult population and the related increase in the need for health and social services, the public health community is challenged to be proactive. So ways to reduce the risk of cognitive health, it's genetic, environmental, and lifestyle factors that are thought to influence the cognitive health. These factors can include public health problems such as heart disease, diabetes, stroke, and depression, brain injuries, some medications or improper use of them, lack of physical activity, poor diet, smoking, drinking too much alcohol, sleep problems, and little social activity, and being alone most of the time. And then moving on to the holistic model, which is over here. It incorporates knowledge and skills from a variety of disciplines to address the physical, mental, social, and spiritual health of individuals. The holistic care is concerned with facilitating growth toward wholeness, promoting recovery and learning from an illness, maximizing quality of life when one poses an incurable illness or disability, and providing peace, comfort, and dignity when death is approached. In holistic care, the goal is to not treat the disease but serve the needs of the total person through healing the mind, body, and spirit. So when asked to describe the factors that contribute to health, most people would list the the basic life-sustaining needs such as breathing, eating, eliminating, resting, being active, and protecting oneself from risk. These are essential to maintaining the physiological balance that sustains life. And then connection with ourselves and others, a higher power, and nature are important factors to influencing health. The fulfillment of physiological needs and a sense of being connected promote well-being of the body, mind, and spirit that enables us to experience gratification through achieving purpose, pleasure, and dignity. So that would be the holistic model, which is right here. The physiological balance, which would be respiration, circulation, nutrition, hydration, elimination, movement, rest, comfort, immunity, and risk reduction. And then connection, self, spirit, family, society, culture, and environment. And lastly, gratification, purpose, pleasure, and dignity. Optimal health of older adults rests on the degree which the needs for physiological balance, connection, and gratification are satisfied. There is a risk that in a busy clinical setting or in a hospital, the less tangible needs of gratification and connection can be overlooked. So as advocates for older adults, us as nurses need to assure that the comprehensive care is provided, we're not opting these important needs. So that would be my poster. Over here, like I said, we have poverty, changes to the mind and cognitive health, and then the holistic model.